Hi, my name is Eoin Kelly. I'm a physician assistant at Signature Healthcare Brockton Hospital. With me today is one of my colleagues, Victoria Zappi, Dr. Gangadharmurthy, and Meghna. We're here to talk a little bit about rheumatic heart disease and a case study we encountered here at the hospital. Tori.
So one of the cases we encountered at the hospital, we had a patient with chief complaint of tremor and palpitations. So this is a 35-year-old Caucasian gentleman who came into the emergency room complaining of tremor and palpitations. The tremor he noticed this morning. The palpitations, however, had been going on for the past couple of months, worsening over the past couple of days. He had no complaint of chest pain, no dizziness, no syncope, no complaints of headache, blurring vision, no numbness, no tingling in the extremities. On physical exam, he looked anxious and tremulous. With his hands outstretched, he did have a tremor. On auscultation to the heart, we heard a pansystolic murmur at the mitral area, 3 out of 6, and an ejection systolic murmur in the aortic area. Remainder of the physical exam was pretty unremarkable. On a review of labs, we got a complete blood count. MCV was 96, otherwise it was unremarkable. We also got a complete metabolic panel. Sodium level was 129, magnesium level was 1.7, and phosphorus level was 1.8. Otherwise, the CMP was unremarkable. LFT's AST was 350, ALT was 136, bilirubin 1.4, and ALK phos of 140. On serum tox screen, we did see an alcohol level of 376. We got a urinalysis. Urinalysis was negative. On urine tox, we did see positive for marijuana. We got an EKG. It showed frequent supraventricular ectopics and brief runs of AFib and atrial flutter. And then we got an echocardiogram, or an ultrasound of the heart. This showed mitral valve thickening, partially calcified, and moderate mitral regurg. It also showed an aortic valve that was thickened, tricuspid, with a peak gradient of 75 and a mean gradient of 45 mmHg. So we have a few diagnoses in this patient. We have alcohol withdrawal syndrome and alcoholic hepatitis. We also have a valvular disease with moderate mitral regurg and moderate aortic stenosis. And we also have paroxysmal AFib. So some of the treatments, we want to treat alcohol withdrawal syndrome with alcohol cessation, first of all, as well as the Ativan CWA protocol. We want to replenish the electrolytes, and we want to monitor the patient and trend the electrolytes. And third, we want to monitor the patient on telemetry to further evaluate the arrhythmia. Now we also have this valvular disease that we need to further characterize.
Yeah, so the case does bring up a few interesting points. The first thing we'd want to determine in this patient is what the etiology of his valvular heart disease is. We want to know what the cause of his atrial fibrillation is. And then when we've discovered the cause, we want to think about treatment. Do we want to put a 35-year-old through potentially lifelong anticoagulation? And we also want to determine things like think about things like the sequela or long-term effects of valvular heart disease. Dr. Gangadharmurthy, why don't you tell us a little bit about the diagnosis, or diagnosing rheumatic heart disease?
Well, you diagnose the rheumatic heart disease based on clinical symptoms, physical exam findings, and also echocardiogram. That is one of the commonly used imaging modality, especially when it comes to diagnosing valvular heart disease. So in the medical literature, we do have major criteria and minor criteria. Some of the major criteria include carditis, which is basically inflammation and swelling of the heart. Migratory arthritis, involvement of different joint with pain. Sydenham scoria, which is basically involvement of brain. You may present with involuntary movement of the arms and limbs when you have Sydenham scoria. But it's very rarely seen. Even I have not seen, but maybe I have seen one case. And also erythema marginatum, which is basically purplish rash on the skin. And minor criteria: fever, elevated CRP, elevated ESR. Those are some of the minor criteria. On the EKG, you may see some prolonged PR interval. So those are some of the criteria. However, in the general population, especially children, they may not be aware of some of the symptoms and And also some of the symptoms may be non-specific. So the children may not complain of symptoms, and they may not come to the hospital to contact the physicians. Those are some of the challenges. Some of the other challenges include currently there is no cost-effective screening tool to diagnose the condition. And also, especially in developing countries, in some parts of developing countries, some population may not have access to the hospital and diagnostic facilities, so it makes it really challenging to diagnose the disease.
What about some of the echocardiogram findings? I think we have some slides. Maybe you can tell us a little bit more about
Let's
them.
talk a little bit about the echo findings. Here we have thickening of the mitral valve and also some calcification of the mitral leaflets. You may also, this is apical fourth chamber view. You can see some mitral regurgitation across the valve, and also interestingly, the left atrium is quite enlarged. And also, as you can see, the septum there is a little bit of bowing of the septum towards the right atrium. So there is, it's a significant enlargement. And in this image, you see enlargement of the left atrium. Interestingly, there is a blood clot. I would assume this patient had some atrial fibrillation as well. When you have enlarged left atrium, it can increase the risk of developing atrial fibrillation. It can cause stagnation of the blood in the atrium, predisposing to formation of the blood clot. That's what we have here. Next one. In this video, you can see some thickening of the leaflets in the aortic valve. So that's what we have.
Now, Meghna, Dr. Gangadharmurthy had alluded to some of the challenges. I hear you have a healthy heart initiative to try to overcome some of these. Maybe you could tell us a little bit more about it.
So the challenges are huge and there are no easy solutions. However, through innovative research and organizational support, we can greatly reduce the morbidity and mortality of rheumatic heart disease in developing countries such as India. For this, we have started an initiative called the Healthy Heart Initiative, which is a nonprofit organization registered in Massachusetts, with the goal of improving cardiovascular health awareness in students, as well as reducing the different risk factors that may lead to the disease in children. Among the different projects in its portfolio, we are currently working on a research project on rheumatic heart disease with the goal of developing a simple questionnaire-based survey tool that can be administered in school children. Actually, next week we will be going to India to conduct a survey on 10,000 students in India by asking simple questions related to the signs and symptoms of rheumatic heart disease and offering an echocardiogram to any students who we believe may have the disease. We will collect data about the demographics, such as the living conditions and the degree of overcrowding, as well as socioeconomic variables such as parental level of education and income. And we will also ask the students about the different signs and symptoms of the disease that they may have. By sophisticated statistical analysis, we hope to be able to develop a predictive model that can be used as a simple scoring system to identify different students who may have the disease so that they can get the treatment that they need at an early stage. Next year, we would like to test this survey tool in Nepal in order to validate it and demonstrate its efficacy, and if it is proven effective, we can use this survey tool not only in India and Nepal, but across the world in different nations that have high prevalence of rheumatic heart disease. Another important challenge, however, is awareness, not only in students and children, but also in parents and teachers, as if they don't know about the disease and the different signs and symptoms, obviously they won't be able to receive the help they need and go to the hospital at an early stage. To increase awareness, we will be visiting various schools and be conducting a multimedia presentation, as well as distributing a pamphlet that the students will be able to share with their peers and family to increase awareness. Later on, we would like to attach these pamphlets to our website that we are in the process of creating so that they can be educational material available to other people as well. The essential element for diagnosing the disease, as mentioned earlier, is an echocardiogram. Unfortunately, this is not easily available or affordable for many families in India. And even if a patient is diagnosed, there is no infrastructure to support the families and children for long-term care. For example, if a patient is diagnosed with the disease in Kolkata, which is the region we will be conducting the survey, which is around 150 miles northwest of Calcutta, there is no medical centers where the students and children diagnosed with the disease will be able to get the long-term treatment that they need. So one of our hopes for the initiative is we will set up a platform where we will be able to connect the students with medical centers as well as individuals across the world who will be able to financially support them to get the care that they need.
So it sounds very ambitious. It does sound like there's a lot of challenges. What do you think is the most immediate hurdle that you guys need to get over?
With all possible means, the Healthy Heart Initiative is trying to work in the field of innovative research. However, we don't have any grants or governmental support. So we really need the support of the public to help make this initiative possible. So we have a GoFundMe, so we would love any support possible, and we also have a Facebook page where you can learn more about the project.
Thanks so much.